Hello, everyone, and welcome to today's podcast on virtual reality and how it is used in today's healthcare. We are actually speaking today with Dr. Spiegel, and this program is sponsored by the International Foundation of Gastrointestinal Disorders, also known as IFFGD. So today, like I mentioned, we're speaking with Dr. Brennan Spiegel, who is Director of Health Services and Research at Cedars-Sinai Medical Center, where he directs the Center of Outcomes, Research, and Education, which maintains one of the largest and one of the most widely cited therapeutic virtual reality programs in the world. So Dr. Spiegel is also a professor of medicine and public health at UCLA. So thank you so much, Dr. Spiegel, for joining us today.
Thanks for having me.
Awesome. So Dr. Spiegel has spent years studying the medical power of the mind. And today he's actually going to speak with us about virtual reality in medicine and how it offers the possibility of treating illnesses without solely relying on intravenous surgeries and addictive opioids. So going into our first question today, when we interviewed you last year at DDW, which is Digestive Disease Week, we interviewed you about virtual reality, also known as VR, and that's how we might mention it later on in this podcast as well. But in that interview, researchers were just beginning to understand how virtual reality works and how it can be used in the medical world. So, can you share with us what virtual reality is and the idea of using virtual reality within the medical field to treat patients?
Yeah, absolutely. So I think most people by now have heard the term virtual reality, may not have tried it, may not exactly know what it is, but virtual reality is a essentially a process where you wear a headset and are exposed to different three-dimensional worlds, so that you become immersed in these worlds. And you can, in traditional virtual reality, you can interact with the worlds around you so that your brain almost feels like it's somewhere else than it actually is. So, most people, when they think of VR, they think of it as a platform for games or for entertainment. You may see commercials on TV now, for example, for different companies making VR headsets, which is changing the way you can play games. But what VR can really do is, if it's used correctly, can kind of modify our perceptions of the world, our perceptions of the world around us, and even our perceptions of the world within us, within our own bodies. And if we use it in the right way with the right person at the right time, we can help improve health when used together with traditional, medical therapies. So it's not like this is some magic wand that makes all illness go away or makes functional abdominal pain disappear, but it can be used in partnership with traditional medications and therapies to help augment them and improve outcomes.
Yeah, I know for me, and probably for some of our listeners, I've heard of virtual reality when it's dealt with gaming. So just getting into this and learning that this is a new thing that's now being used in the medical field, I think is super cool. And I know that studies also show how virtual reality can benefit those living with acute pain, which is commonly associated with GI disorders. And for those who have been clinically diagnosed with upper and or lower GI disorders, how can virtual reality help them?
Yeah, so it's a great question. And in general, VR has been shown to be very effective for pain across different types of pain, both visceral pain, the kind of gut pain that we talk about with functional GI disorders, and non-visceral pain, like what we often refer to as somatic pain or body pains. And often they go side by side. People who have abdominal pain sometimes also have different types of body pains, muscle pains, joint pains, headaches. That's a different type of pain, or neurological pain. So it turns out VR can help reduce all those types of pain because it works not at the site of the pain, but at the site where the pain is perceived, which is the brain. And we know that the brain and the gut are connected. We call this the brain-gut axis. And we know the mind and the body are connected. That's the mind-body axis. And we know that we perceive pain in our brain. So if we could affect the way the brain is perceiving pain, people can not only have less pain, but they can learn how to control their pain. So for example, somebody who might be in the hospital with acute pain, really bad pain, who's hospitalized for it, and maybe they're taking medicines, maybe taking opioids, for example, but it's not really working. We might use a VR headset and bring somebody to a beach, and they can just hang out. Or you might bring them to a forest, or to start swimming with dolphins underwater. It's so totally unexpected for the brain to go from being in a hospital room to swimming with dolphins, surrounded by music, that what happens to some people after a few minutes is they say, oh my God, like I haven't experienced any pain for the last 10 minutes. And probably because it's sort of like a distraction. You know, that's a simple way of thinking about it. But what's really interesting is even after we take the headset off, people often will say, wow, I feel like so relaxed now. I feel totally different. I still don't have as much pain. And that might persist for a while. And so we can talk about what's happening in the brain and why that's happening. But clinically, what we see is people can have benefits that last after the headsets come off and can persist sometimes for hours, sometimes even for days after they've had that experience. So it's not that it cures IBS or cures any kind of pain, but it does teach you that your mind has some control over how you perceive pain, and you do have the ability to do that. And VR makes it just easier and faster to learn how to do that.
So, in part of speaking about how the brain perceives certain things and how the brain's really, honestly, the biggest thing that VR is associated with and helping with, patients who experience anxiety or depression have maybe seen an improvement in their overall health since using virtual reality. And for those living with GI conditions, anxiety and depression are commonly felt, and especially during difficult times. And like now, we're in the middle of a global pandemic. So, can you explain to us the connection between virtual reality and mental health and a person's overall well being?
Absolutely. It's a great question. And I'll start by going back to pain for a second, because pain has two parts to it. There's the physical part and the emotional part. And we know this because actually Buddha said that many, many years ago. Buddha said that pain has two arrows. He called them the arrows of pain. And the first arrow is like if you get hit by an archer and you get hit in your shoulder with an arrow, that really hurts. Physically, it hurts. But the second arrow is when you look at the first arrow and you think, oh my God, I'm going to die. That's the self-inflicted wound. That's the emotional part. You think, oh my God, I'm not going to survive this. Okay, so pain has two components. There's the physical pain, but also the emotional component of that pain. And it turns out there's two different parts of the brain that, if you simplify it, there's the sensory cortex, which is the part of the brain that detects the physical pain itself. But then there's a part of the brain called the limbic system, which processes the emotional part of pain. And in MRI studies of the brain of people with VR, it shows that VR can reduce both the sensory cortex activity and the limbic system activity, both the physical and the emotional components of pain. And that's allowed us to also think about how VR can help with anxiety and depression, whether or not there is pain. And it's also been shown there to work. And part of what's happening there is anxiety is, we think about it as sort of like this ruminating mind that we have. It's inner voice that's talking to us and judging us and fretting and worrying about the future, usually about what's going to happen. And depression is kind of thinking about what already happened, the past, lamenting the past, lamenting what happened with a relationship or somebody's passing. And they're very related to each other, anxiety and depression. What they have in common is this inner ruminating voice. that won't stop talking. And it turns out we've been able to show that VR can sort of help dampen down that voice and give you better control over it, just like a psychedelic can. And I'm not advocating to use psychedelics, but there's been a lot of research with psychedelics now that shows that it can reduce that inner voice from talking. VR is like a cyberdelic. And it turns out there's been a study comparing a cyberdelic VR versus a psychedelic head to head and show that they both have very similar effects on the human brain. So if we use it in a thoughtful way, we can use VR not for people to live in it all day. We don't want people to live in VR and become dependent on VR. No, we want them to learn something about how their mind works and the control they have over it that can give them control over physical experiences like abdominal pain too.
Yeah, and I think what you touched on of being in control, I think that's such a big part, not depending on something, but learning how you can control what's going on in your mind and how you perceive certain things. So besides pain management and helping to treat anxiety and depression, are there other applications for virtual reality in medicine?
Oh yeah, there's so many applications now that the FDA is even considering this to be a new field of medicine. And that's something new since we last spoke, is the FDA has given a name to this. They call it medical extended reality, or MXR for short. So they're calling it MXR. And medical extended reality is about using these types of computer programs to positively support health, not to use it for gaming or entertainment or to make people dizzy or angry, playing first-person shooter games. VR could do all that too. We're talking about using VR to support health. That's called MXR. And to get to your question, there's so many different applications beyond pain, anxiety, depression. Those are very well researched, those particular applications. But within the field of GI, for example, we're always interested in nutrition and eating. And so, for example, obesity is one area where VR has shown some benefits. Really amazing. So there's some researchers in Italy, this guy named Giuseppe Riva, who's done a lot of this research with obesity. And he's shown that using VR, he can help people lose weight. And the way he does it is if you are overweight, he can put a headset on you. And when you put the headset on, you look down, and rather than seeing your body the way it is, you see a thin body, or not even thin, just a normally shaped body. And you look down and you go, and you look in a mirror and you see yourself and you think, oh my God, like I am a normally shaped person, normal by objective standards like body mass index. And there's something about literally seeing yourself that way that can change the way the mind perceives the body. And what he's done is he uses VR with this mirror experience where you see yourself through a mirror, and then he combines it with cognitive behavioral therapy, which is a standard treatment to help with eating disorders. And then he compared it to cognitive behavioral therapy alone. And he found that using VR led to greater weight loss, and it was more sustained over the course of a year. So that's one example. Another example with eating is from Japan at the University of Tokyo. They've used VR to change the way a plate of food looks. The food might look smaller than it really is, or might look bigger than it really is. By looking through the headset, they can change the perception of the amount of food you're eating. And they have shown that if they expand the amount of food on your plate, you get full faster. Even if you're eating the same amount of food, your brain thinks you've eaten more if it looks like it's bigger. So he calls these diet goggles, where you put the goggles on and all of a sudden everything looks really big. And he's literally shown that people get full. They go, oh, I'm so full. But if you take the goggles off, eat the whole plate, you're like, I can eat more. So perception becomes reality. Our minds are, in a way, kind of easily fooled. And we're not trying to fool people. We're just trying to take advantage of that and nudge the brain into more positive behaviors. So that's another example. And there's so many more I could talk about today, but that's just a couple.
Yeah, I think it's super cool though how you kind of touched on that it's not something that's really being utilized in the United States, but is internationally being used by doctors all around.
Mm-hmm.
So I think that that's pretty cool also to kind of realize that this is obviously new and developing, but people all over are experiencing the use of VR in the medical world.
Yeah, that's right. All over the world, we're starting to see, I mentioned Japan and Italy and Europe. In the United States, there are now over 200 hospitals that are using VR. But I think many listeners who are listening to this might think, well, geez, where do I go to try this? And we might talk about that. But there's still not near enough clinicians or doctors who are even knowledgeable about this, don't even know about it, much less are trained in it. So at our hospital, we're developing a new clinic where people can come in to get treatment. We still haven't set it up completely. It's getting set up now. Right now, we do it through research studies. But there are doctors still all around the country, not a lot of them, but they're starting to do this more and more for all sorts of things, for phobias too, for stroke rehabilitation, which is a whole other area, for physical rehab, for Parkinson's, for dementia, for schizophrenia. The list goes on and on.
Wow. Yeah, and I know you were kind of starting to touch on it, so maybe we should try to go ahead and ask. Maybe some of our listeners are asking today,
Mhm.
and they're wondering how can they make virtual reality part of their treatment plan, or even when might their healthcare provider introduce virtual reality as a therapeutic option for them?
Yeah.
And like as a doctor who uses it, what would you say about that, and how would you answer it?
So I do use virtual reality in my clinic. Unfortunately, less these days because we're doing so much remotely until the pandemic is over. But before the pandemic, I keep a VR headset in my clinic, and I will use it very frequently with people, particularly those with functional GI disorders or IBS who are having pain, um, and put them in a forest or swim with dolphins, and show them that look, you have this incredible ability to affect the way the mind perceives the body, and we talk a lot about that. It's one thing to talk about that, but it's another to experience it. And having experienced it, it's much more profound and meaningful. So that's one way I use it in the clinic. There are headsets that people can purchase. Just so you know, I don't have any relationships with these companies or anything. So this is just from our own experience. So a lot of people these days are buying this Oculus. Oculus is a company that makes headsets. There are other companies, but the reason I like Oculus is because they have an app store. Just like if you have a smartphone, there's an app store. It turns out there's thousands and thousands of apps, VR apps, that you can download from the VR store on the Oculus store. So, the most recent one is the Oculus Quest. It's called the Oculus Quest 2. It does cost a few $100, so it's not a cheap thing. It's less than a smartphone, but it does cost a couple $100 or $300 or so. And when you get it, you can download different, games and all that, but you can also download other things. So one program I really like is called Trip VR, TRIPP VR. Again, I don't have any relationship with them, but I know the developers, and they've done a really good job creating an amazing experience where you go through these beautiful scenes, and it's a little trippy. That's why it's called Trip VR. But you can also upload photographs of your family, friends, anything you want from your life, and they are integrated within the environment. So it's very personal and really beautiful. Another one is called Nature Trek, which is really just a gorgeous, beautiful scenes that you spend some time in. There are other companies making programs specifically for pain through the FDA. There's a company called Applied VR, and they have their own headset and their own software that you can go directly to their website and obtain. And again, I don't work for them or anything. But I can tell you that we at Cedars-Sinai, where I work, are just starting to build a VR program for IBS, specifically for IBS. And we know for years that different forms of cognitive behavioral therapy can help with IBS. It's not the entire, it's not the full cure for everybody. It's not like, the magic bullet for everyone. But when used together with traditional therapies, whether it's, medications or antibiotics or whatever you might be using, having cognitive behavioral therapy can definitely improve your outcomes. That's been shown. So the problem is there's not a lot of psychologists around and people don't necessarily have access to them. So we're trying to essentially create a CBT treatment for IBS. And we're just starting right now to program that. And I'm really hoping the next time we talk, we'll have something to share and be available in the Oculus store to download. So we're working on that.
Yeah, I think that that's super cool to also know that like patients have the opportunity to potentially experience this on their own, and how you mentioned incorporating your own personal pictures of family members and making it more relatable to yourself. I think that that's extraordinary just to even know, because I think that that can also help with the treatment process using virtual reality.
Mm-hmm, mm-hmm.
As we begin to kind of wrap things up, we have to ask, you have a new book and it's called VRX, How Virtual Therapeutics Will Revolutionize Medicine, and it was recently released. We have to ask, what is your favorite part of this book and why? And then lastly, how do you foresee virtual reality becoming part of standardized therapy for patients living with chronic illnesses?
Yeah, well, thanks for mentioning that. So yeah, the book, as you said, it's VRX. You can get it wherever books are sold, Amazon, etc. And it really tells the story of this new field. And even if you're not interested in technology or VR, it's really about what is this teaching us about our own consciousness? What does it teach us about the way the mind and the body are connected? And how can we really, as you're asking, integrate this technology into clinical practice within a Western medicine framework? This isn't some voodoo science. This isn't, new age weird stuff. There's over 5,000 studies that support virtual reality. So I summarized some of the big ones. And actually my favorite part of the book is in chapter 1, the very beginning of the book, where I describe having a complete out-of-body experience in virtual reality. And, like I said, I'm a Western trained doctor, and, I'm not like a voodoo scientist or anything. And so when I heard I could have an out-of-body experience, I was like, I don't know about that. But I went to the University of Barcelona and they put me in a headset, and all of a sudden I became a different person and I could see myself in the mirror. And then they split me apart and I floated up to the ceiling and I looked down and I saw my body down below. I had just left my body. And it was weird. I had died and was going to heaven. And the thing about it is it didn't feel catastrophic. It felt almost mystical, like spiritual. And so after that, I said, I need to figure out what was happening in my brain that I could be fooled so easily by a computer. And what does that teach me about the way my brain works? And how could we use that technology to do other things that are, how could we use that out-of-body experience even to help people who are anxious or are dying even, so that they can practice their death in a way that doesn't feel catastrophic? So those are all big questions, and I address that. And the whole first part of the book is about what happened in my brain. And the second part is, well, how can we take that science and really start using it for conditions like IBS? And the third part is kind of getting at your question, like, how do we really start to do this in clinical practice? And I've described a new type of doctor called the virtualist. And I think there's going to be such a thing before long. The virtualist is going to be the doctor who really knows mind-body medicine and technology and virtual reality and knows how to responsibly combine them all in partnership with traditional medicines to help improve lives. And I talk about what that will look like one day and exactly how it's going to work at the end of the book. So it was a lot of fun to put the book together.
Well, I think that you've touched on some really good points here and just helping us better understand what virtual reality is and how patients honestly can have it incorporated in their day-to-day life if they want it. But what I think that you really touched on, there were some great points that's commonly associated with patients who suffer from GI illnesses is that virtual reality can help those who live with anxiety, depression, or chronic pain or acute pain. So, all of those that you mentioned were really good points. And we just thank you for sharing your insights on this unique topic and for speaking with us today about virtual reality and how it's used in the healthcare field today.
Well, thanks for having me. I always enjoy being with you.
Awesome. And thank you, everyone who listened to our podcast today.